Today, we would like to post this video specifically for patients that are looking for relief with medical marijuana and they don't know where to start. Our patients with My Florida Green leave fully informed with a folder as well as an order sheet, and we instruct them on what to do for their first round, but there are many other patients that have not come through My Florida Green that may need some extra help. Sleep and chronic pain are the two most common ailments that we see coming through our medical marijuana certification center. And sleep is what I want to touch on first. There are two strains of the plant. Sativa, which is a stimulant, appetite suppressant, can be energetic, and then Indica, which is AKA in the couch. And it sounds like that for a reason, because Indica can be more sedative, more relaxing, and a great strain to introduce before you go to bed. So a sublingual of Indica, okay, that's oil underneath your tongue, 20% is absorbed pretty rapidly, 80% is metabolized when you swallow it. Onsets are usually between about 20 minutes to an hour before you feel the effects. An oil dropper of Indica underneath your tongue before you go to bed is extremely effective for going to sleep and having a good night's sleep. Your relief period through sublingual is 4 to 6 hours. Okay, so this is a great regimen, a great replacement for some of the narcotics that people are drugging themselves with before they go to sleep. And just another plug here that marijuana has never killed anyone in history. In the 10,000 years it's been used as medicine. Very therapeutic as well. So Indica sublingual before you go to bed, and it's lights out. So for relief during the day and a more controllable delivery method, we would recommend inhalation, which is a vapor. You have capillaries in your lungs that absorbs the compounds, delivers them to your blood instantly. Fast in, fast out. It's about 20 minutes to 2 hours of relief. But these are great if you just need to escape. They're great if you're treating pain, but keeping in mind that it's in and out pretty quick. So now I want to talk about the preventative measures that we need to take while we're treating our conditions, right? We talked about how we're treating sleep, and that's going to be the Indica sublingual, but now I want to talk about or touch on the chronic pain. Capsules can be a little bit of an experiment because they're considered an edible. You're ingesting. It takes an hour or two for you to feel the effects, but the results can last between 10 and 15 hours. We recommend for the newcomers a 1-to-1 capsule, and that's 1 part THC to 1 part CBD in a capsule. I personally have a story with capsules, and I'm very sensitive to THC. I don't like how I feel when I get too psychoactive. I started on capsules about 10 days ago. First day was a little rough for me. I got very psychoactive, didn't like how I felt, but I embraced it because I knew that the next day it would get a little easier, and it sure did. And then by day 3, I was brand new. Day 4, I don't really feel too much psychoactive anymore, but I do feel elevated and my body is numb. And it's numb in a good way, not in a bad. So for a chronic pain patient, I would recommend a 1-to-1 capsule 1 to 2 times a day, keeping in mind spacing them out depending on your sensitivity to THC. Now, if you get too psychoactive and you don't like it, what do? You take CBD. The CBD is the non-psychoactive and anti-psychoactive part of the plant, and it will often cancel out the psychoactivity of THC. So keep that in mind, and it's good to have a bottle of CBD on hand when you need it. So for me, I'm sensitive to THC. If I try my vapor pen and I get too psychoactive and I don't like it, I introduce the CBD, which often cancels out the psychoactivity almost instantly. Keeping in mind that if I'm taking the 1-to-1 capsules and I don't like how I feel because I'm too psychoactive, I may need more CBD, like as a couple doses throughout the day, to regulate my psychoactivity. So hopefully this video helps some of you people that are out there that are just experimenting and trying for the first time. We want to keep you safe. We want you to medicate responsibly, and do know that we're here for you. myfloridagreen.com. Click on Get Started.